Dr. Olu Jegede is the Chief Health Equity and Community Impact Officer at Cone Health. He's here today to talk about the importance of each of these for long-term wellness and how you can access free health screening. So to start, why is keeping our blood pressure and blood sugar in check so important, Doc?
Oh, thank you for having me. Blood pressure and blood sugar are two of the most important indicators for long-term health. So when they are uncontrolled, they quietly damage the heart, the brain, the kidneys, and the blood vessels and can lead to heart disease, stroke, loss of vision, even nerve damage, and even kidney failure. So the good news is that regular screening and early detection and action can prevent many of these outcomes, and people can live longer and even a healthier lives.
When it comes to blood pressure checks, if someone isn't getting their blood pressure checked regularly, how would they know that they might have high blood pressure? What could be the symptoms?
So many people really don't have symptoms. They have high blood pressure for a while, but there are no symptoms at all. That is why it is known as the silent killer. But in most cases, people might have maybe a headache or dizziness or vision changes or chest pain. Some people might have shortness of breath. The challenge here is that all these symptoms may show up late and sometimes even after a serious damage has already occurred. And that reminds me of it, a 38-year-old patient who was seen by an eye doctor and was sent to the urgent care immediately. And what the eye doctor has seen was those signs of a long-standing, uncontrolled high blood pressure. This patient hasn't been to the doctor for many, many years. And it's like unfortunate, but fortunately, she was diagnosed with high blood pressure and started on medication. But this is how it could sneak in on you, and complications already happening before you can get help. So here's what I'm asking you to do at home. Check your blood pressure at least once a year, and more frequently if blood pressure runs in your family. It takes only 2 minutes to do, and it could change everything. It is very important to know your numbers.
So you said it takes 2 minutes. What is the process? How do you do it?
At the doctor's office, there is a blood pressure machine that will be put on your arm, well rested, and they pump it, and then it checks your blood pressure. You can also do it at home if you had the blood pressure machine, or even Walmart or Walgreens. You walk in, it's free, you get your hand in the machine, and it reads your blood pressure. If it is reading something above like 130 over 80, you need to call your doctor and say you need to be seen because you have checked your blood pressure and it looks like it's high. Or if you come to events like we're having very soon, you can be checked there for your blood pressure and you know the numbers.
What causes high blood pressure typically?
Usually there is no cause. It happens like family history, genetics. Sometimes there are causes we call secondary high blood pressure, which is something is happening in your system that is driving your blood pressure to go up. It constant stress brings all the hormones out to your body, and it can make your blood pressure go up. So many other causes could be responsible for high blood pressure. But most of the time, by far majority of patients, is because of genetics.
All right, let's switch over to blood sugar now. First of all, can you explain what is blood sugar and why does it matter?
So blood sugar, we all require blood sugar in our system. That is how we function. But it is not good to be too low or too high. And the ranges are there, but if it is too high, you could have symptoms like just or constantly want to drink water, frequent urination, you are tired all the time, blurry vision, or unexplained weight changes. So some people may even experience like numbness and tingling in their hands and feet. So if someone feels off and isn't sure why, I say just get your blood sugar checked, and that will provide clarity. And again, early detection greatly helps to prevent long-term complications.
We do have more to talk about when it comes to blood sugar, but we have to take a quick break. Doc, hang out for just a couple minutes here. We're going to take a quick break and we're going to get back to it in just a minute. Stay with us.